Ready? Perfect. It's going. Thank you all for coming. We appreciate it. When I was originally asked to do this, we weren't quite sure the direction that we wanted to go. And so I know that there's a lot of clinical people here. Some of the information that I'll present today will probably be very basic to somebody who knows anything about the heart. But we do have some other people here, and so hopefully it'll be beneficial no matter what it is. I just realized this remote isn't working, so I'm going to have to walk over and hit the slides every time. So today's little lunch and learn is about the heart. My name is Trevor Spencer. I actually was hired at the hospital here to do echocardiograms, which are ultrasounds of the heart. I actually have a couple of cool ultrasound pictures on the presentation today. But as part of me coming here, Charlie wanted to start a cardiac rehab program. That was something he felt that our community could benefit from. And so I also have a degree in exercise physiology, and he thought that might tie in nicely. And so we started a cardiac rehab program. And so we'll talk a little bit about not only the heart and the structure and function and things like that, but also about the cardiac rehab program that we have started here at Stuyvesant Medical Center. And it's actually been very beneficial to the patients that have gone through it. So first of all, the heart, it is an amazing organ. Now I am kind of biased because I get to sit and look at the heart all day, every day, and I think it is a really cool thing. But it is an amazing organ. It never takes a break. Think about that. It never takes a minute off. If it took a minute off, you would feel terrible. It never takes a minute off for 70 years. It works. It's awesome, and it is very efficient for that entire time. Think about this. Your heart pumps over 2,000 gallons of blood every single day. It beats over 100,000 times a day. That's over 35 million times a year. That works out to over 30-something billion times in a lifetime. Your heart is an amazing organ. The other part of this is an adult's heart is about the size of 2 fists. So if you take your fists and put them together and put them up on your chest, that's about the size of your heart. Okay? The heart is a muscle, just like any other muscle in your body. It contracts and relaxes just like your biceps do, or your triceps, or your quads, or your hamstrings, any other muscle. It gets bigger and it gets smaller with each beat of the heart. It is 2 pumps that sit side by side. People don't realize this, that actually your right and left side, while they are very, very connected and they do similar jobs, they actually don't do the same thing. Your right side pumps blood to a very small area, your lungs, so it sits in the middle of your chest. The right side of your heart is just pumping blood to the lungs. That's it. It doesn't do anything else. Then take the blood from your body, pump it to your lungs. The left side of your heart is the bigger pump, the main pump, and it's the pump that pumps blood to the rest of your body. The structure of the heart. Your heart has kind of a good rule to remember about the heart is the heart has 4 of everything, almost. It has 4 chambers. You'll see that the top chambers of the heart are called atrium or atria. The right atrium, the left atrium, then there's the 2 bottom chambers of the heart, the right ventricle and the left ventricle. In between each of those chambers, there is a valve. So on the right side of the heart, it's called the tricuspid valve. On the left side of the heart, it's called the mitral valve. The heart also has 2 more valves, for a total of, again, 4 heart valves. So we have the tricuspid valve, mitral valve. We also have the pulmonary valve, which leads from the right side of your heart to your lungs. The other valve in the heart, or the 4th valve, is the aortic valve, which leads from the left side of the heart to the rest of the body. So remember, 4 valves, 4 atria, or 4 chambers, the atria and the ventricles. It also has 4 pulmonary veins and things, but we won't go into that. Your heart, just like any other muscle, is supplied it needs to have blood in order to work. That blood, that oxygen-rich blood, is supplied by coronary arteries. Now, it's kind of a misconception, or maybe people just haven't thought about that. Because your heart is full of blood all the time, people I have talked to assume that the heart just gets the oxygen it needs from that blood that's going through it. That's not the case. The heart has to be supplied by blood vessels. And these blood vessels run on the outside of the heart. These are called coronary arteries. There's a picture of the coronary arteries. The heart also has an electrical system. So, similar to a house, we have the plumbing, which I just showed you, the coronary vessels, and then it also has the electrical system. The electrical system, while again, they are very interconnected, is something totally different. So you can have a problem with the plumbing and have nothing wrong with your electricity. Or you can have a problem with your electricity and nothing wrong with the plumbing. But it has an electrical system. The heart follows, the electricity in the heart follows in normal, quote unquote, pathway. This normal pathway begins in the SA node, which is in the top of the right atrium. It travels across the atria, both the right and left atria. As that signal travels across those atria, it makes that top part of your heart contract. In simple terms, we call that the lub. If you've ever heard of the lub-dub of the heart, the lub is the top part of the heart contracting. That's the signal going on across the atria. That signal is then all gathered back into right about the middle of the heart, right above the mitral tricuspid valve on the septum here, and it's called that valve there is called the AV node. The AV node then pauses that electrical signal just for half a second to allow those ventricles to fill, and then it sends the signal back out down the middle of the heart, which then spreads out around the outside and tells those ventricles, okay, collapse. And they contract. That's the dub. So your heart beats lub, dub, lub, dub, lub, dub, lub, dub. And that's because of the electrical impulse that travels through the heart. That's the normal pathway of electricity going through the heart. You can have all sorts of complications to the electricity in your heart. Heart disease then. Heart disease, according to the CDC, is the leading cause of death in the United States. People of all ages and backgrounds get the condition. In fact, if you go to that same website there, that statistics from the CDC, it says that heart disease kills more people per year than the numbers 2 and 3 combined. So what is heart disease? Heart disease is not only heart attacks, which is the major thing that we'll talk about, but it refers to several different kinds of conditions. Heart disease can refer to things, like I said, such as coronary artery disease or a blockage in a blood vessel in the heart. But it can also mean a valvular disease. You can have, stenotic valves. You can have regurgitant valves. You can have lots of other different valvular diseases. Or it just may be that your heart's not pumping well enough, either from a heart attack or because of some other reason, a virus that attacks your heart, things like that, that can lead to something called heart failure. People of all ages get this disease. Heart disease, I wanted to show this. You'll notice, I know these numbers are very hard to see, and these aren't the same. It's not the same scale. But look at this map. Heart disease in adults 35 years and older across our country. These are the death rates. So heart disease that actually kills people across the United States, 35 years and older. If you notice, the same map of adults killed by heart disease, 65 years and older, there is not a whole lot of difference there. I wanted to point that out. The heart disease kills even young people. It's not just an old disease, like a lot of people assume or think. So the first thing we're going to talk about today is the first disease we're going to talk about today is coronary artery disease. So coronary artery disease is when there's a buildup in those blood vessels that supply the heart muscle itself with the oxygen-rich blood that it needs. So as blood goes through those coronary arteries, over time, we get a waxy buildup of plaque, cholesterol, other substances that kind of bind themselves to the walls of these arteries in our heart. It takes a long time for this to happen. This doesn't happen overnight. That's why people that are teens, typically, they can, but typically don't have heart attacks, is because it takes time for that plaque to build up. As that plaque builds up, it obviously narrows the amount of space that the blood has to go through. Because the blood's not going through at such a high rate or a high rate of normal, it can cause some symptoms. A lot of times people who have coronary artery disease or the beginning stages of coronary artery disease don't notice anything unless they're being active. When they're resting and when they're sitting, nothing is happening. They feel great. But when they get up to walk around, when they get up to exercise, when they get up to move, and their heart starts requiring more oxygen-rich blood to keep pumping, it's not getting enough because there's this narrowing. There's this plaque buildup that's causing some problems there. Not allowing enough blood to go through. As the plaque builds up and builds up, it can make those become narrower and narrower until the point where either one of two things typically happens. There's a lot of things that can happen. One of two things typically happens. Either that plaque builds up so much that it totally occludes the artery itself, just the plaque, or a part of that plaque will break away and rupture. Now think about this. Your arteries they're really big. Your aorta is about this big around, right as it comes out of your heart. Your vessels get smaller and smaller as they go out throughout your body. The same thing with your heart. Those coronary arteries are relatively large right at the beginning of them. But as they go back out and around your heart, they become smaller and smaller. So if you have a blockage up here, and a piece of it breaks away and goes into one of these smaller vessels down here, that's a problem now. Because up here it wasn't occluding anything, but down here now it blocks that entire heart muscle tissue, and tissue starts to die. When tissue starts to die, it's called a heart attack. That's another misconception that people sometimes have, is that a heart attack is just having chest pain. It's not. A heart attack is when heart tissue actually begins to die because of a lack of oxygen-rich blood. Okay? The other problem with this, though, is, or not a problem, but another thing to know about is you don't need to have been diagnosed with a heart attack in order to be diagnosed with coronary artery disease. In fact, we don't want you to have a heart attack before we diagnose you with coronary artery disease. That's why I'm here, is because we're trying to help you not have a heart attack and not have to go through that, not have tissue die before we can intervene, before the doctors can help you out. Any questions about coronary artery disease? Cool. So just a quick slide. I had to put something in there to prevent coronary artery disease, and we'll talk more about that. But it is pretty important, that first point there, that heart health in general has a lot to do with your lifestyle. So if you want a healthy heart, you have to have a healthy lifestyle. It doesn't work any other way, and that's something to keep in mind. Ways to prevent coronary artery disease and to slow its progression is to have a healthy diet, to exercise. The American College of Sports Medicine, which are kind of the gurus on exercise, say that a person should get 30 minutes of moderate level intensity exercise at least 5 days per week. So that's a goal that you can kind of shoot for. And then obviously a big one that everybody knows is to not smoke. Smoking has a huge impact on coronary artery disease.
Trevor? So if you did have coronary artery that plaque build up, can you diminish it on your own without changing your diet?
You can. So there's two kinds of cholesterol, the good cholesterol and the bad cholesterol. I say you can to a point. Plaque that is non-solidified, the waxy plaque still, you can get rid of because of the good cholesterol that travels throughout your body and kind of scrapes those walls, is what that good cholesterol actually does. Once those plaques have hardened, though, it is actually, you can't. There's nothing you can do about those. So there is and there isn't. there isn't a way to get rid of the plaque that's in your arteries. Second thing is the valvular heart disease. So again, your heart has 4 different valves. These valves open and close. Now I just told you that your heart beats over 100,000 times a day. That means those valves open and close 100,000 times a day. As you might imagine, sometimes things can go wrong with those valves opening and closing 100,000 times a day. Some things that can happen, and that typically do happen, is that you can have a valve that, you notice that these are all closed very tightly. They don't have a whole lot of space in between them. But sometimes they don't coapt, or the leaflets don't come together just right. And you have blood that leaks back down through. That's called regurgitation. If the amount of regurgitation gets bad enough, it causes problems. It causes symptoms in patients. It causes things to happen. Of note, though, is that almost every single person I bet if we did an echocardiogram on every single one in this room, I bet all of us would have some degree of valvular regurgitation. But most of us, that valvular regurgitation isn't enough to do anything about. It's only when it gets to a certain point that doctors begin to worry about that valvular regurgitation. The other thing that can happen is over time, and as we get older, just with anything that happens in our body, calcium can deposit on those leaflets. And instead of having an opening this big, now the calcium makes the opening shrink down into a very small diameter. That's called stenosis. Some things out in the media today are called aortic stenosis. You may have heard some things about aortic stenosis. You can have mitral stenosis. You can have tricuspid stenosis even. But those are the two kind of main valvular issues. There is also another thing just of note, because I know certain individuals have had this. This aortic valve sometimes can have what's called a bicuspid aortic valve, where instead of having 3 different leaflets here, you only have 2 leaflets, which can also cause a problem because it in effect doesn't allow that valve to open all the way like it would in a normal person. It opens only a very small amount, meaning it's kind of functionally stenotic. And you then have to have valve replacement surgery. So they can either go in and cut out the valve and put in a mechanical valve. They can put in a pig valve, a cow valve. They can put in your own tissue to make a heart valve, but you'd have to have that replaced in some way. These valves are actually really important because if you think about it, your heart is a big pump and it pumps really well and really efficiently. But if it doesn't have something stopping the blood from going backward, all that would happen was your blood would go from top chamber to bottom chamber to top chamber to bottom chamber to top chamber to bottom chamber, and nothing would get ejected out of your heart. That's what these heart valves actually do, is make the blood keep going forward and out to the rest of your body. So this is kind of a cool thing. I don't know, I may have skipped over the last one. Probably did. This is actually an echo image, and I want you to look at that. And if you noticed in the last echo image that I had, it looked a whole lot better than this one. I look at these, and so I see this all the time. These are actually the ventricles, or the bottom chambers of your heart. This is the right ventricle, this is the left ventricle, this is the mitral valve, this is the tricuspid valve. If you notice in this heart has a really, really big left ventricle. That if you can, again, pay attention to this area right here, isn't moving much. It's not squeezing very well. Now this patient probably has something called a dilated cardiomyopathy, but in effect they are in heart failure. Heart failure is simply put when your heart fails to push the blood forward. It's a very easy thing. It doesn't have to be more complicated than that. It means that for whatever reason, whether it's a heart attack, whether it's some sort of cardiomyopathy, a virus that just sits in your heart, some other reason, your heart is not able to move the blood forward. And therefore your heart is failing to keep up with the demand that your body has for it. When something like heart failure happens, you begin to see that the ventricle starts to dilate because the blood's not moving forward, so it's just getting more and more full. Somebody in that situation does not feel very good at all. So what the American Heart Association, or www.heart.org says, with heart failure, the weakened heart can't supply the cells with enough blood. This results in fatigue and shortness of breath, and some people have coughing. Everyday activities such as walking, climbing stairs, carrying groceries can become very, very difficult. That is really actually an understatement. I had a patient who came through our cardiac rehab that was in heart failure, and literally he had to stop. After he would get out of his car, he said, he would stand up and have to lean against his car. He would take 2 steps to the front of his car and have to lean on his car and catch his breath again. He would grab the door to his house, which was 2 steps away, and have to lean on the door. Somebody who has heart failure, especially that progressed, does not feel well at all. Is not able to function very well.
What do you do to fix? What do they have to do to, like what you're describing? What did he have to do to fix?
So that is actually a good question. So heart failure, again, is kind of the umbrella term for a lot of different diseases. There are some of those underlying causes that are irreversible. If you get them, you don't get better. And honestly, that's the sad, hard truth about it. In a candidate who's young enough and healthy enough, a heart transplant would be the option. There are some that, with diet, exercise, and things, they can regain some function. They can regain a certain level of function.
But it depends on what done.
It depends on why you're in heart failure.
Those were the same symptoms that I had that required the valve replacement.
Go ahead. So an arrhythmia, then, moving on to something a little bit different. So arrhythmias, like I said, the things that we've talked about to this point, the heart failure, the coronary artery disease, the valvular disease, that's all the plumbing in your heart. That's all to do with that plumbing side. Arrhythmias are having to do with the electrical side. Again, they are very related. One can cause the other, but they are two different and distinct things. Arrhythmias have to do with the electrical system of your heart. So the heart muscle, like I said, it has a very, very specific and normal, quote-unquote, pathway that electricity follows. And every heart that they've mapped out, it generally is the same. AV node, SA node around the atria to the AV node down the middle of the heart, out to the ventricles, and that's how it pumps. In some people, though, that system is disrupted or delayed for some reason. I always tell people, or when I'm describing it to somebody, I tell it to you like it's a freeway. So the electrical signal's traveling down a freeway. But as is the case, I come from Utah, there's a lot of construction on the freeway sometimes. And so you have to get off the freeway and you have to detour around. Do you still get to your destination? Yeah, you do. But you don't get there nearly as quickly. Same thing with an arrhythmia. It's just like the freeway is blocked and the electricity has to go a different route to get to where it needs to get to. because of that, you can have certain symptoms. You can have things that happen to you. There are many, many types, and I'm not even going to touch the surface of how many arrhythmias there are. But the most common arrhythmia, according to the American Heart Association and the Centers for Disease Control, is atrial fibrillation. Atrial fibrillation is where the top part of the heart, which is normally controlled, the whole heart, the electricity of the whole heart is controlled by that SA node. For whatever reason, and again, there's a myriad of different reasons for this, that SA node is no longer the pacemaker. Your heart also has an amazing ability to contract by itself, to conduct its own electricity. In fact, when they harvest a heart from a heart donor, and they cut that heart, as gruesome as this might seem, they cut that heart out and lift it up for a certain amount of time, that heart will continue to beat outside of the body because it's able to conduct its own electricity. For somebody in atrial fibrillation, though, that pacemaker is not in charge anymore. All these different rogue groups of cells are saying, I want to go, I want to go, I want to go. And so consequently, you're not getting that nice lub like you did before. You're kind of getting a quivering. And now the bottom part, which usually took its signal from the top on when to beat, this dub, doesn't know when to go. And so it goes dub 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 dub. And it's not a normal march like you would normally have with a heartbeat. Those actually two rhythm strips at the top, that is a normal EKG, that is somebody who's in atrial fibrillation. Why does that even matter? Because you're still functioning. Somebody in AFib can live a normal life. In fact, I've had somebody who didn't know they were in AFib and by the cardiologist's estimation, probably had been in AFib for 30 years, and they didn't know. So you can function normally with AFib, so why do we even worry about it? There are a lot of things that can happen to somebody in AFib. This person actually just ended up being very, very lucky that they didn't have one of these things. Blood clots can form in the heart. It can cause other arrhythmias. It can cause other things to happen. So it is something to be aware of or be concerned about if you know that you have it. There's a list of some of the symptoms that somebody in AFib might have. The other important thing to remember about atrial fibrillation is, though, just like I mentioned, not always do you have any of those symptoms, or not always do you recognize that those symptoms are caused because your heart's in a funny rhythm. You can have no symptoms and be in AFib. And the only way a doctor would know is if he felt your pulse or he listened to your heart. And then they'd say, hey, we need to get an EKG to check it out. So the whole purpose of this, or one of the main purposes of this Lunch and Learn, is how can we help here at Star Valley Medical Center? Because we don't have a big facility with a lot of cardiologists and an IR suite and take care of people. But the one thing that I did want to stress or bring up is that we can help people with heart disease and heart problems. We actually have two cardiologists that regularly come to our facility. Dr. John Lassiter, who's out of his association is with ERMAC. In Idaho Falls, and then Dr. Larry Green, whose association is with the University of Utah. He actually lives here. The idea is that they come every 2 weeks. Not always does that happen. Sometimes they come in the same week. But the idea is that we have a cardiologist here every 2 weeks to take care of the needs. These cardiologists actually are very, very good. I don't know Dr. Lassiter as well because I didn't work with him. I do know Dr. Green very well because I worked with him at the University of Utah when I worked there. And I respect and trust both of them. They're good cardiologists. They know what they're doing. As I mentioned before, I'm here. I do echocardiograms. Now, right now, we actually only do transthoracic echocardiograms. Sometimes I've had occasion where somebody's called and said, I want a TEE, which is a transesophageal echo. We don't do those here. That requires anesthesia and all the whole 9 yards. And so we don't do those here. But we do transthoracic echocardiograms.
So explain that.
A transthoracic echocardiogram is an ultrasound of the heart. So it's just like looking at a baby in a woman's belly, except we look at your heart and your chest instead. So we use the ultrasound probe with some gel. There's specific areas of the heart where on your chest where I have to look in order to see the heart, but we just take a bunch of little movie clips of your heart beating. It's about 150 little movie clips of your heart beating. We make measurements of the heart, how the valves open and close, how the heart squeezes. Those pictures that you saw before, those little movie clips, those were echocardiogram pictures. The whole process takes about 45 minutes to an hour to have an echo done. But you get lots and lots and lots of good information from an echo, especially in somebody that's having some sort of heart problem. We have nuclear medicine stress testing. So right now the truck The nuclear medicine truck comes in. That may change shortly, but the nuclear medicine truck comes in and does stress testing. We're looking at doing echo stress testing. That's still in kind of the planning phase. We have abilities to do EKGs, 12-lead EKGs. Patients are monitored on the floor with EKG. There's lots and lots of people who can read EKGs. The doctors are pretty proficient at doing that. So we can tell the electricity in your heart. And then there's this thing that we started called cardiac rehab. The statistics may not bear it out as far as what the CDC reports, but in my personal guesstimation, and because I deal with people who have heart problems, our valley here, for as small as it is, has a very large percentage of heart disease. There are a lot of people in this valley, for as small as it is, that have heart problems. And so this cardiac rehab can be a real benefit, and has been a real benefit to the people that have participated. So cardiac rehab is a comprehensive service provided to individuals with cardiovascular disease. The primary goal of a cardiac rehab program is to help people get back to doing what they love to do. Let me give you an example of what I mean. I had our very first patient when we very first opened our cardiac rehab was a gentleman who'd had heart disease since he was 35 years old. He was 64 at the time he enrolled in our program. He had his first heart attack at 35. He had multiple heart attacks subsequent to that and had never done a cardiac rehab program. His doctor finally said, "You need to come in and you need to just try it." And since he's kind of a snowbird, comes back and forth, when he got here in the spring, summer, he said, "Fine, I hear they're starting a cardiac rehab program, I'll be their first patient." He, in a former life, before he ever had his first heart attack, was a cyclist. He told us, and Matt can help me here, but he told us that he would bike the coastal highway in California. He liked to do that. That was something he liked to do. He rode his bike all over the place. When he had his first heart attack and subsequent to that, he lost all interest in biking. Felt like he couldn't do it anymore. He came to our cardiac rehab, he sat down on our recumbent bike back there, and after 2 or 3 sessions he said, "This is what I love to do. I love biking." He got that adrenaline rush, that endorphin rush, whatever it was that happened to him, and he loved biking. So much so that his goal was to ride from Star Valley Ranch to here on his last day of cardiac rehab. He did an amazing job with that. But that's kind of the change that we want to see in people. It is possible to live a healthy, happy, normal lifestyle with a diagnosis of cardiac problems, heart disease. But it does require some work and some lifestyle change. So that's kind of the goal of a cardiac rehab program, is to maybe initiate or help people get back on that road to doing the things they really want to do, that they like to do. I don't know if anybody, I know a few of you here have, but I don't know how many of you have had surgery on your heart. That is a life-changing event. Think about it. A doctor puts you to sleep, cuts your sternum open, spreads open your ribs, and for not being holy, monkeys around with your heart, and then closes you back up. That can be a real life-changing event. That can be something that can have emotional problems. That you can wonder if you're ever going to be able to have a normal relationship with your wife again, if you're ever going to work again, if you're ever going to ride your bike again. There's a lot of things that come along with heart disease that cardiac rehab tries to address. So it's more than just a program to get you to exercise more. That is a big part of it, but it's not just that. So there's some of the things that are included in a cardiac rehab program. So it's not only the prescribed exercise, education about heart disease and the risk factors. If you smoke, we offer smoking cessation. Ideas and tips on how to lower your cholesterol, control your high blood pressure, lose a little bit of weight. It's not about losing weight. I don't have anybody in our program that I hound about losing weight, but the fact that you're going to exercise more and that you're going to eat healthier is going to make you lose some weight. It just is. And so we talk about weight loss and control. If you have diabetes, the cardiac rehab program will help you maintain that control over your diabetes, increase your physical activity, and develop better eating habits. There's a bunch of different websites that promote the benefits of a cardiac rehab program. I kind of just picked a couple here. I am not God, so I have no idea how long a person is going to live. And that's not up to me. But what I do know is that if a person has heart disease and they participate in a cardiac rehab program, whatever time they have left is going to be of a higher quality than if they had not participated in a cardiac rehab program. So it says live longer and lessen your chances of a heart attack. I don't know about the live longer, but I do know it's going to lessen your chances of a heart attack. Control heart disease symptoms, chest pain, shortness of breath. It was funny, another one of our patients that came through cardiac rehab told us how much they didn't want to even start because they felt tired all the time. And I said, that's exactly why you need to come do this, because we're going to make it so you're not tired all the time. And sure enough, by the end, she was able to do a lot of the things that she wanted to do, ride a horse and go hunting. You can stop or reverse the damage to blood vessels in your heart, lessen physical and emotional stress. Again, these are all things. One of the things that I did want to mention is we have a lot of great people that are really actually dedicated to our cardiac rehab program, and I'm grateful for them. Our dietitian, Chrissy, our social worker, Matt, and all the physical therapy people. They are honestly, we have a lot of fun, and it's a good program. So even if you're not the one who's maybe interested or needing this, if you know of anybody, let us know, because we do want to have them enrolled in our program. Then, unfortunately, I would like to help every single person that even mentioned that they had heart problems, but that's not how insurance companies work. The insurance companies say you have to have a specific diagnosis in order to be enrolled in a cardiac rehab program. There they are. I don't need to read through them all, but those are the diagnoses that Medicare says you have to have at least one of those to be enrolled in a cardiac rehab program. So again, if you know of anybody, if you yourself have had something like that, talk to your doctor. It does require a physician's order, so it's not just anybody can walk in off the street. We do have to have a doctor's order for it. Any questions for me? Perfect.
All right, well, when Joel was kind of setting this up, he wanted me to just kind of address a couple of the things that I talk about with people in cardiac rehab. So as part of the cardiac team, there's actually 4 lessons that I have the opportunity to teach those that are in cardiac rehab. And honestly, I could spend the next hour, 2 hours, 3 days just talking about all the dietary interventions that, I could go on for hours about cardiac health and, and following a cardiac diet and things like that. But there's 4 main lessons that I teach. The first one is about cholesterol and fat. So what we do in that lesson is we talk about your HDLs, your LDLs. We talk about what your good cholesterol is, your bad cholesterol. What is it that makes it good? What is it that makes it bad? A lot of people don't really know and understand that. So we talk about kind of the pathophysiology of some of that stuff. We talk about nutrition interventions and lifestyle interventions on how we can raise your good cholesterol and how we can lower your bad cholesterol. And as he talked about a little bit about atherosclerosis, kind of that thickening of the heart vessels and things like that. Well, that's where that comes into play. By doing that, by raising your good cholesterol, by lowering your bad cholesterol through heart-healthy nutrition interventions and lifestyle interventions, we can help minimize some of that plaque that accumulates on the wall. I talk a lot about the role of sodium and hypertension and things like that, and how sodium kind of function in the body, how it controls or contributes to nerve impulses and electrolyte balance, fluid balance primarily is what we're worried about, how it pertains to blood pressure and how we can help control your blood pressure through sodium restrictions and things like that. We talk about diet interventions to accommodate that. We talk about heart-healthy eating, and I'm just going to kind of go through the list of topics that we cover when it comes to heart-healthy eating. We talk about sodium, fats, cholesterols, HDLs, LDLs, triglycerides, and then how to translate all of that information into your everyday life. We talk about increasing fiber intake and the role that fiber has in a heart-healthy diet. We talk about food labels and exactly what to look at when you're at the grocery store. We review different types of fat and the effect that they have on heart health and what appropriate intake should be and things like that. We review how to adhere to a sodium restriction. We talk about healthy cooking methods. We talk about kitchen tips and suggestions that you can practice at home. We talk about omega-3 fatty acids and fish oil supplementations. We talk about plant sterols and stanols and the roles that those play and how to incorporate those into a heart-healthy diet. And then last, and probably one of the most important lessons that we have, is about obesity and diabetes. Fun fact, and something that a lot of people aren't aware of, is that 65% of diabetics actually die from heart disease. And so we talk about how to appropriately control diabetes so that you're not at that increased risk for a heart attack and dying from heart disease. So I just wanted to kind of field a couple questions. Are there any questions you guys have on kind of my function and the role in cardiac rehab? Or any nutritional questions about heart disease that you've just kind of always wondered and would like to ask at this time? Okay, I'll go ahead and turn it over to Matt. Are you going to take a minute or two?
Yep, perfect. Well, I think I have the best job, because I just tell jokes during cardiac rehab and keep the people going and turn up their speed on their treadmill or make them go harder when they're not looking or whatever. So we'll be working. Oh, you want me in front of the camera? I am happy to announce I got my wellness results back. My LDLs are down, my HDLs are up. So triglycerides are also down.
Nice.
And yeah, so it's been a good year. Anyway, exercise, as Trevor talked about, the heart is a muscle. So how do we make muscles bigger? We make them by exercising. So you asked about chronic heart failure, and in some cases, it's because after a heart attack, the electrical system's kind of messed up a little bit, and then the muscle starts to die. But if it's a smaller heart attack, as the electrical system kind of fixes itself, then those muscles can come back alive. And so that's why exercise is important. I had one gentleman, he actually wasn't in the cardiac program, it was before that, but he was sent to me as a physical therapist to rehabilitate. And he went from an ejection fraction of, I think it was in like the 30s or something like that. That's a bad number, right? And but it increased to a very good number, which I don't know what the good numbers are. The point being is through that exercise and through and just through the natural course of healing, he improved. Some people may ask, well, why can't I just exercise on my own? And Trevor may have said this already, but the biggest thing about cardiac rehab is we do it in a safe environment where we're watching the activity of your heart. So if we see a problem, whether it's through the EKG leads that we're constantly monitoring, that's Trevor's main role during the actual treatment, or one of my main roles besides telling jokes is to take their vitals throughout while they're exercising, while they're resting, and watch those. And those can be tells for us whether there's a problem or whether we're doing the right thing. And so it's in a safe environment. So with cardiac rehab, there's always 3 different stages or phases, and we're what's called a phase 2 program, and then a phase 3 is a less monitored, and that's kind of what we'll sometimes do in a physical therapy setting without the EKG leads and that kind of stuff. So as far as my part today, I just wanted to open it up for any questions, benefits of exercise or anything like that. Does anybody have any?
What role, if any, does strength training play in cardiac health?
Well, I know I don't have the exact answer for that. Strength training, vigorous strength training, heavy strength training would be avoided right after. We don't want to avoid the heavy strength training because it causes what's called the Valsalva maneuver, and it increases the internal pressures on the heart. But I don't know, Trevor, could you answer that any better?
Physiologically, what you're trying to accomplish in a cardiac rehab is you're trying to get that muscle stronger, and it gets stronger, like Matt said, by being stressed. Just like any other muscle, it gets stronger by being stressed. If you were doing resistance training or weight training, where you were actually getting the heart rate up and maintaining that heart rate up at a certain level, then it would have benefit cardiovascularly. Other than that, if you're just doing 10 reps and then you're sitting for 20 minutes and then doing that actually doesn't have a whole lot of heart benefit. Like Matt said, immediately post-op or immediately after somebody's had a heart attack, we don't recommend you doing any sort of strength training. But physiologically, anything that gets that heart rate up, get the heart to pump, work a little bit harder, and maintain it at a certain level would have benefit.
So cardiovascular focus.
Uh-huh.
Yeah, so it's all an endurance focus, just whether it's running, biking, walking, anything that's gonna keep the heart rate at a, talked about moderate exercise 5 days a week. We want it into that moderate exercise level. Otherwise, it's not gonna do you quite as much good. In order for any of the systems in your body to improve, you have to stress them. That's just how it works. Any other questions, comments? All right, well, turn it back over to Trevor.
I don't have anything else to say. Thank you all for coming.